Go ahead and get started. Again, I want to welcome everybody to the call. It's really, really exciting times. Great things happening in the world of Monavie. As I mentioned in my email about this call, I'm going to keep it limited. I'm going to keep it to 30 to possibly 40 minutes at the high end, and there's a couple of reasons. One, it doesn't need to be longer than that. It should never take longer than half hour or 40 minutes to have a conversation about Monavie, the opportunity, the products, especially for those that are having home tastings or overviews of whatever sort. We want to make sure that we're honoring people's time because, hey, we live in a different society today. Everybody's busy. We're running in 90 different directions. We don't have a lot of time, and so the more you're working, if you're in a family like ours where husband works, wife works, kids are off in 90 different directions, it's hard to corral somebody for an hour and a half, 2-hour presentation. They don't have time to do that. So Monavie, along with our leadership, we're looking at streamlining these meetings. We're going to get the point across, get the delivery within 30 to 40 minutes, and we're done. So people, if they knew that would only take 30, 40 minutes to understand what's going on, they'd be more and more likely to attend the tastings and stuff. So what I'm doing tonight, I want to first of all thank you all for being here. I will be moving rather quickly. As like I said, I want to make sure this is done in less than 40 minutes, and I want to keep it streamlined so people can get on with their night and move on. So, the first thing I want to say is the webinar that I'm showing you here, the flip chart that I will go through tonight, is a little bit of a modification. I've added a few slides because I want to get a point across. Not only am I going to use the new Monavie flip chart, I'm going to do a little teaching about how to use the flip chart and how to have a conversation about Monavie. As you meet people, you'll have a kind of a format to follow. So the regular file, the regular PDF or the PowerPoint that you would want to use, you can either buy it from Monavie VO in the back office, or you can download it from their website, which I'll show you how to get there a little bit later. So the first thing is I want to have one disclosure before we get started. We're not here to treat, cure, or mitigate disease. I know sometimes people look at our products and they say, well, what is it going to fix? Well, here's the deal. We're here to provide people with options. We're here to bridge the gap between where they're at physically, where they're at in their dietary habits, and where they need to be. We know that the amount of nutrition someone needs, the amount of antioxidants needed in the body today, these folks want to live a happier, healthier, life. And so, to do that, you have to have enough nutrition to make that happen. The reality of it is very, very few people do. So what we are saying here about Monavie is that, bodies will function in the way that they were designed, provided they have enough fuel, enough energy, enough antioxidants to support in order to do that. So we're here to bridge the gap. And so when people say, well, does it fix this? Does it fix that? Listen, you give the body proper nutrition, you'd all be amazed at what the body can do all on its own. So anyway, this flip chart was modified a bit, and like I said, a little bit of teaching, so we can kind of get through the whole point of the flip chart and maybe a little bit of a heads up on how I'm personally using it. So this is how I've been sharing the world of Monavie. I'm not using these slides that you see right now. So this slide is for us as we move forward, but it's not something I'm showing to someone as I'm sitting down with them, so you know. What I'm doing here is I'm showing that this is a format. It's all this is. I mean, there's exciting times right now with this scanner. The Monavie scanner, the new View scanner, is a game changer. And so I wanted to structure myself in a way that I can replicate what I'm doing, deliver a message, do it in a way that I'll remember it, number one, and that it's getting the point across to other people. So I came up with these 4 areas of conversation. That's all these are. One is awareness. It's the first one. And so that is our first thing. This is nothing more than, why are we here? Why are we doing what we're doing? The next is going to be discovery. Well, people are going to want to know, with this View scanner, where they are personally. Where is their personal antioxidant score? Everybody's so excited to find out. sometimes you get a little bit of an eye-opener once you find out, but, everybody at least initially wants to know, hey, am I good, bad, or ugly? And so the scanner is providing that. So that's what discovery stands for. Solutions is, depending on what that number is, the next question is, well, what do I do to change it? And we're going to be talking about that. And then last, it's not going to be first, but last we're going to talk about the opportunity, because here's the deal. If they're not aware why we're looking at this, or why Monavie's products even exist, if they're not aware of where they are personally and what the solutions are within the Monavie products or otherwise to fix those, depending on those numbers, then the opportunity really doesn't manifest itself. Not to say that there's not going to be people that see an opportunity first and foremost, and that you have to use your own wisdom there. Sometimes I'll talk to someone that says, let me see how it works. I want to know more about the juices. I want to know about the science behind the juices. I want to try it for a month or 2 or 3, and then we'll see where it goes. They ultimately, at one point or another, do take a look at the opportunity and move forward. There are some that say, hey, if it's a great product, if it's a great company, and it's got all the DNA of where this is going to go, and we can take advantage of this, some people will see the opportunity day one, and you'll just have to make that distinction as you're moving forward. So let's go ahead and let's go to the next slide, if it'll take me to the next slide. Here we go. The first one is the awareness. The awareness is basically, hey, why are we here? And what I wrote here was just some things that I learned with some of the people that I've been working with. Some of these statistics come from Monavie. They're all over the internet. They're on PubMed. They're my local hospital. I mean, these doctors know the doctors I'm currently working with, which are quite a number of them. They know the numbers. They know what the studies are showing. Hospitals and clinics and family practice, these folks know where the problems are, and they know that most of our population, that's where it starts up here. Studies show that less than 3 fruit and vegetables eaten every day increase your risk factors for stroke, cardiovascular disease, certain types of cancers, and cardiovascular mortality. We know if you're not eating right, you're paying a price. I remember when I first looked at Monavie back in 2006, before I did anything, and this is back before there was any science behind the products, this is way before we really knew why this stuff worked, I sat down with a very good friend of mine when I got my first bottle of juice. I sat down with him with little information they had in brochures, and he's a radiologist. He now lives in Orlando, and I asked him, what do you think about all of this? I'm a realtor. I'm not a doctor. I'm not a nutritionist, but I'm interested. I wasn't happy with where I was financially, physically, for sure. And so it did capture my interest, and I'll never forget what he said. I wrote it here because it was ingrained in my mind day one when he looked at me and he said, Rick, he said, here's the deal. 90% of our American population is not doing what they should be doing. The health of our country is failing. And from a physician's perspective, he says, anybody you talk to, I don't care who you are, I don't care what clinic, hospital, doctor's office, if you were to ask them, where is the health of our country going? And they would all say it's depleting. There's no question. Now, science of medicine and treatments and medications and surgeries and all, medicine has done a great job at improving in that area, but our country as a nation is getting sicker. And he said it, and I'll never forget it. He said, here's the deal. When you sum it all up, Rick, we're digging our graves with our forks. By what we eat, how often we eat, the wrong stuff that we eat, we're basically killing ourselves with what we eat, he says. And so what you're looking at here as a product, I don't care what's all in it right now because we didn't have all the science on it. He says, but I can tell you this, if you're getting 7, 8, 9, 10 servings of fruit and vegetables, antioxidant equivalent, it would be something I would drink every single day. That's all I needed to hear, and that's why I got started with this. So, what's going to happen now is as you look at what's going on in our environment, when I talk about awareness, it's just bringing people up to snuff. We have an obesity problem. We have a malnutrition problem. We have an obesity problem. The stats are terrible. 33% of school-age children are overweight. 10% of school-age children are obese. 13% are morbidly obese. That is pretty tough. That's why you're starting to hear across the country that kids are starting to be prescribed statin drugs because of cholesterol issues. And, the day you start giving statin drugs to a 12 or 13-year-old child before fixing all the other things, it's scary. 60% of adults in North America are overweight, 36% are obese, and by the year 2030, they're predicting that the number of obese adults will increase to 42%. Do you realize we're talking about literally almost half the population of North America to be in an obese status? I mean, it's incredible. And so, you look at the risk factors, and I spoke to some local doctors that are in our group, and, they're talking about diabetes and hypertension, your cholesterol levels, liver disease. I mean, you read through here. I don't have to mention them all, but here's the thing. If you're not eating right and you're not getting your nutrition, it's going to increase your risk factors for all kind of nasty stuff. If you're overweight by a little or a lot, the heavier you are, the higher the risk factors you're going to have. And you know what? Our lives are going to be impacted severely by those choices. And that's one of the things the local physicians that I've been working with have all said is 90% of the things that they see as doctors, they're all preventable. If they were able to get to these people sooner, they can change the course of someone's life. And so certainly improve their life. Certainly some people get out of trouble, but sometimes, we work with these critical care doctors. By the time you see them, you've already got the damage. And it's always the question is, can he? So not making endorsements of hospitals. We're not making endorsements of clinics or personal physicians. But I am saying this. In Monavie is pioneering a structure that's being used for medical facilities. What we're starting to see, and I can say this, that we're starting to see major practices across the country starting to look and starting to accept the Monavie products, the line of products, certain products, certainly the Reveal, in use in these environments. So the time has come that if you're talking to a physician, if you're talking to someone in medicine, whether it be clinic, hospital, family practice, it doesn't matter. If these physicians in these institutions are proactive, then they're going to be looking at Monavie's products with a really wide open eye, because there's no question what we're doing and the gain that we're starting to make is amazing. So Monavie is at a pioneering point in the history of the company, that as we move forward through 2013, 2014, you're going to see across the country, you're going to see our products being embraced by major medical facilities. It's already happening. I can't even begin to tell you how it's exploding from what I'm seeing. And I'm just a little guy in the totem pole, but I can tell you that we are starting to plant some seeds in some major organizations across the country. They're very interested because the products that we have are absolutely stellar, and they know it. They've been looked at against other products that are out there that these facilities have utilized in the past, and what is coming out at the end of the day is there's absolutely no comparison with what we are offering, comparatively speaking, to what's out in the marketplace. So we're just in a whole new place, so we're excited about that. Well, here's the deal. We're going to talk about the scanner. The scanner is our game changer. This is where we get to see how well we're doing. We're introducing the View patented antioxidant scanner. This was just released a few weeks ago, and it is definitely a game changer. It is definitely patented. What it's going to do, and I've said this before, if I go back 5 years ago, 6 years ago, in my trek with Monavie, and just look at it and say, okay, well, how does this scanner impact us? Well, here's what I'm seeing, and here's what we're experiencing so far. Where before, the use of the Monavie products, it took some time for people to realize they would have an experience with it. And let's face it, almost everybody that I enrolled over the years, they all wanted to try the juice. They said, let me see how it works. Well, you know what? It's interesting about the words how it works. We're all waiting for that feeling. And, sometimes you get it soon, sometimes you don't. Some people got it in joint pain. Joint pain would go down. We were allowed to say that. Monavie will increase energy. We have seen it reduce inflammation, joint pain. I mean, it goes on and on and on. There's a lot of approved claims that we can make. But you know what? All those claims, take time. But you know what? I'll tell you what you can't tell. You can't tell how well the free radicals are doing in your body. How many do you have today compared to yesterday? What are your antioxidant levels? What's your free radical damage? What's your oxidative stress looks like? What kind of damaged DNA do you have as a result of your dietary habits? You know what? You just don't know. But that stuff does exist. So this is where we get to see how well we're doing, and we get to do it quickly. So Monavie, with their new 60-day guarantee on their Monavie certified products, we can now scan somebody, get a nutritional score for them, and then whatever products that they choose, if within 60 days that score is not improved, 100% money-back guarantee. And there's not a product, I don't know of a product in the country that has ever come into the marketplace that has done anything even close to that. So this is where it all comes to where I say the rubber meets the road. We can prove without a shadow of a doubt in your body what our Monavie products are doing and how well they're helping you. Long before you feel it, you're going to know. And so the View Pen and the scanner was just released. We're really excited about it. My wife has one. I have one. We're just busy with these. Everybody is getting scanned. So this thing's we're going to wear our first scanner out. So I'm going to go to the next slide. We have the science to prove the value of the products. That's really what this is all about. This is what the scanner was created for. Huge amount of money in the development, huge amount of time, effort, expense to create the scanner. I can't even tell you how many millions of dollars went into the development of this. But the reason we did it was for one reason and one reason only, to validate the value of the Monavie products. Without a shadow of a doubt, every single person in North America who ever gets a bottle of juice and tries this product for 60 days is going to know without a shadow of a doubt what this product is doing in their body. And I think that is absolutely totally exciting. So onto that, I'm going to go to the next page. And that's your discovery. This is what the scanner is all about. This is and I wrote up here, it's an optical scanner. It measures the carotenoids and flavonoids that exist in your body. Now we know the amount. It's like 5,000 different ones this scanner reads. It's exclusive. It's an amazing amount of money that went into development of this thing, and I got to tell you, they use some reflective, they call it reflection spectroscopy. I don't really know what that all means. All I know is it's the same type of light that they use in the Hubble telescope that they project in other planets, where they can analyze those atmospheres and know what's in the atmospheres of planets we've never been to. So it's that same basic concept that was redesigned and applied for human use, where we can actually, through your skin, emit that light source and get that number back that tells you basically how your antioxidants are inside your body. And they're saying that the blood work as compared to your skin is a better reflection of your overall health than maybe blood work would even be. And the reason I'm hearing that is you can alter that in 24 hours, blood work. You can, drink a lot of orange juice on a Friday night and probably have a lot of vitamin C the next day, but it wouldn't necessarily show up in your skin because you haven't done it consistently for 60 days. So it's a better measure, and they're saying 60 days of consistent habits, it will end up in your skin, which is why they have the guarantee after 60 days. Because if you drink the products as directed for 60 days, that guarantee will hold true. So amazing stuff. Next slide I'm going to go to real quickly. Like I said, I'm going to move fast today. This is basically how it works. You get a color spectrum, and you also have a life score, which gives you a number. But initially, this is what you have. You have the low end over here, and you have the high end over here, which are your purple, your blues and purples. Down here, your reds and oranges are not so good. And the way I can explain it, and the way I understand it, is this. If you were to draw a line right in the middle here, and let's talk about, sorry, I didn't mean to do that. Oops. I'm going too fast. Give me 1 second here. There we go. All right, back to this page again. I'm going to draw the Ben Franklin line right through the middle here. And the way it was explained to me was on the left side, let's just say you have a ratio between free radicals, which is your oxidative stress, these sort of damaging things that happen in your body that cause all the bad things in your life to happen. If you have a high level of free radicals in your body, and your body produces them every single day. It's a byproduct of energy. It's a byproduct of stresses. It's the damaging things that happen to your body. Well, what happens is if you have, I'm sorry about that, let me page that up again. If you have more antioxidants than you do free radicals, then you're suppressing. You're in a good state. But here's the danger. If you're over here and you're scoring on the left side of the color spectrum, what it basically means in English is that you are producing more free radicals in your body than you are the antioxidants to keep them in check. One of the local physicians I was talking to just the other day said, your body produces cancer cells every day. And again, I'm not saying we're here to treat, cure, or mitigate, cancer. I'm not saying that. But your body does produce them every single day. Everybody's does. But your nutritional well-being has a lot to do with how well you keep that into check. And so what happens is, this goes for viruses, this goes for all kind of ailments. If you have your nutritional score low enough and long enough, then you can have some major problems over a period of time because you're just not on the upper edge of where you could be. And so on the other hand, if you're on the right side of the scale, that means you have a nutritional profile that's actually very good, very high, which means your nutritional score, your antioxidant score is higher than your free radical output. So as you're pushing out those free radicals, you have more than enough antioxidants to keep things in check, and therefore you have a healthier, happier, you've got a better functioning body. That's the whole idea. Now, for the first time, we can show someone in 2 seconds, 5 seconds actually, where they are in the color spectrum. Are they low or are they high? Here's the deal. Everybody can improve. I came in and I was here, and I'm now here. And I was drinking the juice, but with all the things that I was doing, I was scoring upwards in the yellow area, which isn't bad. I'm still on the right side of the spectrum. But you know what? I didn't want to be there. I want to be as high as I can get. And I made the appropriate changes in October to increase my nutrition. So instead of drinking 2 ounces of Monavie twice a day, I drank it 4 times a day. Not a big deal, because I'm doing more. I'm exercising more. I'm doing a lot more meetings. I'm working 2 jobs. And so I'm putting more stresses on my body. And you know what? 2 ounces twice a day for me, it was enough to keep me on the right side of the spectrum, but it wasn't enough to get me into the blues, and the purples. And so I started doubling my juice, and I moved my score 15, almost 20,000 points since October 5th of this year. And so I made the change, and it worked. And isn't that great just to know that you're here when you were here, and God forbid if you're down here. You don't want to stay there forever. So, the negative effects on your score has to do with pollution, smoking, unhealthy diet, being in the sun too much, lack of sleep, excessive exercise. Excessive exercise. I had one person that just scored not too long ago who's a marathon runner that scored down here. Eats right, eats healthy, but didn't eat enough volume of those kind of foods to wait out the amount of exercise that person was putting in. Let's face it, 7 to 10, 15 servings of fruit and vegetables every day for the average person. You're a marathon runner, you are burning up way more than the average person, and therefore you'd have to supplement a lot more. So the good news is, wherever your score is, we'll guarantee that within 60 days we will improve that score or your money back. So that's just an amazing stuff. So you know that if you're down here, you have the high risk factors associated with the things that we talked about earlier in the slideshow. The heart disease, the cardiovascular problems, all of those things, those risk factors go up if your nutritional profile is too low. The higher it is, the better, the healthier the body, and the better off you're going to be all together. Okay. Monavie's products, let's talk about these for a bit. I'm 57 years old, and I learned that one thing at age 50, my warranty started to expire. There's no question. I mean, joint pain started coming in, and just things didn't operate the same way. And I look at these 4 quadrants here, and Monavie has spent an inordinate amount of time, energy, and money developing just absolutely stellar products that combat these 4 areas. They wanted to make sure we're a full circle company. We want to make sure we can address every area in nutrition that needs to be addressed. And these are the biggest problems. You've got people out there that have low energy. Well, we have products that combat that. Unstable blood sugar, where you get your weight gain, eating the wrong kind of foods, overeating at one part of the day, undereating on another part of the day, or eating the wrong things. Anyway, blood sugar stabilization, people don't eat enough, eat right, eat healthy. That's where you get your weight gain. The weight gain, and obesity is linking to all these other health problems. And so Monavie wanted to address the blood sugar area, and they've done that. Stress. I mean, I don't know anybody who isn't under stress. I mean, it's been the most stressful 7 years in a lot of people's lives since the economy took a turn. And, it was stressful enough without that. But you know what? There's been added stresses put on people over the last 5, 6, 7 years. Well, that's taxing on the body. And Monavie has created a new line that was just introduced that absolutely addresses stress. And I'm on the beta trial of this stuff. And I got to tell you something. I love it. I am absolutely in love with their new product. So I'm personally on everything. Then you talk about oxidative damage. Well, that's where all the free radicals get that foothold. And if we don't have enough antioxidants to combat that, well, then we're going to have increased risk factors for all the things we never want to have. And so to me, it was the most wonderful insurance policy I can get that I had control over. Is because I'm not waiting until I get sick and then have an insurance policy. My insurance policy is keeping me from getting sick, and I decided to put my money where my mouth is, so to speak. So then we have the solutions, all right? You get your score is low, or it's not where you want to be. Well, you know what? Here's the deal. Again, this is just a conversation. We talked about awareness, why, risk factors, things like that. We talked about the scanner. We'll let people know where they are on the scale left to right, good, bad, or ugly. Now we have a solution. Okay, what do I do now that I have my number? Well, you can always do it on your own. I've never seen anybody do it, but you know what? It is an option out there. Someone says, listen, I'll go out and buy myself, 15, 18, 20 servings of fresh fruit and vegetables every day, as raw as I can get, as organic as I can get it, and I'll eat it every day for the rest of my life for myself and my family. You haven't done it yet. The likelihood is you're probably not. It's going to be like the New Year's resolution that lasted until January 7th. I just know how it is. Good intentions just don't always get it done. So Monavie's product line was designed to be not only nutritionally complete, but easy and cost-effective. You just could not buy 15 servings of fruit and vegetables for the kind of cost you're seeing in the Monavie product line. It's just unheard of. So we have our line of antioxidant-rich juices, and we'll talk about those in a few seconds. And then we have the RVL meal replacement, and I call it meal replacement because it's meal replacement. It's for protein for athletes. This product has just been endorsed by the IOC, which is the International Olympic Committee. There was hundreds and hundreds of products that were looked at. In May of last year, only one was chosen, and it was Monavie's RVL meal replacement. It was the most complete. They absolutely loved it, and now you're going to have that product used and endorsed worldwide by the IOC. So I think that was an absolutely incredible testimony to the product. So you've made it when that kind of stuff happens. So we have the meal replacement system, money-back guarantee on that as well. So that is not only for weight management, for increased nutrition, for meal supplementation, nutritionally complete to the point that it'll raise your score as well. So you still get your 60-day money-back guarantee. We have our line of antioxidant-rich juices. Again, 60-day money-back guarantee, Essential, Immune, Active, Pulse, and the new MX Platinum, which I'm going to talk about in a second here. Here's the four components all coming together, one full circle company. Oxidative damage, we have our juices. We have our Essential, which is the purple bottle, 19 fruits, the acai berry, all patented ingredients, all patented processes. I mean, we've got the patented and trademarked Asavi. It's the only one of its kind. It's the only one that carries a patent, and then the blend is also patented. So you have the Essential, you have Monavie Pulse, which is for cardiovascular and cholesterol, help people keep their cholesterol in check. 19 fruits, a little different formulation, but resveratrol and plant sterol is high enough to help you keep healthy cholesterol levels. You've got Monavie Immune, which is their immune product, which is helping people respiratory illnesses. I mean, it's helping people keep great immunity, keep their immune systems high enough. Hey, I'd rather drink that than be using those hand sanitizers everywhere you go. You know what? It's okay to use the hand sanitizers. That takes care of what touches my hands. I want to take care of what comes in. How many know your hand sanitizer, when the person behind you that's standing in the checkout line is coughing, your hand sanitizer is not going to help you, but Immune will. So that's what Immune was set up for. Monavie Active has the added glucosamine, 19 fruits acai berry, great product. And for joint inflammation, it's been the core line product since 2005. Then along came MX, which is their new platinum blend. MX are all of these juices combined together, for the exception of the pulse. And we understand that may be incorporated in a not too distant future. But basically, one-stop shopping with this one. This one gives you all three rather. And then it adds another 11 vegetables, which none of the other blends have. So you're ending up with, in this particular bottle, 31 different varieties of fruit and vegetables. And so for antioxidant support, to minimize oxidative damage, there's not a product better than this on planet Earth. For your increased energy, we have the Monavie Energy drink, all natural, the E and EMV Light, great product. A lot of athletes using this. Doesn't give you the heart palpitations, sustained energy. Your energy comes from the right sources instead of stimulants, from caloric intake. It's a great product. You have the Monavie Reveal, which we talked about earlier, the nutritional shake, the dietary supplement, the new protein bar with the hydrolyzed protein, and then we have their snack bars. Great product. We have lots of people, and I'll mention one person's name. It's a patient of one of the physicians that got on the Reveal program in May of 2012. He went back up north from Naples in May, got on the product, weighing in just around 400 pounds. He's a professional football player. Retired professional football player, and he came back in December. He's around 279 or 280 pounds now since May, and he is just talking up a storm. I mean, he is so happy, and he should be, because all his medical profile's changing, his blood's changing, all his risk factors have dropped, and he's only been on the product since May. Serious about it, but here's a guy that hasn't been below 300 pounds in 20-some-odd years. And, these doctors are taking notice that their patients are coming back looking like this, going, what can we do if we did this with everybody? And then we have the new VSIT that just came out that helps you with stress, controlling stress. There's a tablet you take in the morning, all natural, one you take at night. And I've got to tell you, I don't know what they did with this. I am really happy about this product because I can notice the difference in the first week that I've been on those. These will not be available until August of this year. But just know that it's coming. So full circle company, product line, you pick whatever you need and you take it from there. Then the last part of this, and we're going to wrap it up with the opportunity. Well, you've gone through all of this. Then the opportunity is going to be interesting because here's the thing. The View Antioxidant Scanner I wrote, it changes everything. Why? Because it brings a level of credibility that we have today that no one has in the marketplace. We have the perfect storm of opportunity. I wrote down perfect storm of opportunity because of a few things. When you have science of our products meeting the View, coming together, you have the best of everything because now our science has now met the product through the View. And so you look at the population, you say, okay, when you have an opportunity that takes into consideration that 90% of the American population is either overweight or undernourished, that's our audience. You take a product line like Monavie that's all been patented, it's all protected, it's all exclusive. You take that scanner, which is also exclusive, also patented, and you bring it all together. We have just formulated a huge solution that addresses 90% of what's going on with our American population. And we can do it cost effectively, and we can do it now. There's no waiting. We can improve people's situations in less than 60 days. Why the scanner is so important is because people want proof. We had to wait for that feeling before, not anymore. If you can't feel your oxidative damage, you can't feel the amount of free radicals, but I tell you what, I can show you where your numbers changed in the last 60 days, and that's all people need to know. Down here where I talk about the 90-10 rule, 90-10 rule applies here. This is our business model. Our goal is to get people healthy, get them using the products. I know it's a great opportunity. I know it's a great business, but keep in mind, the people who see the vision are the people who will always show themselves. But you know what? We want everybody getting healthy, whether they want this as a business model or not. Business model is getting people healthy. That's really important. Charlie Calb used to say it, it's like in the Shrek movie, pick me, pick me, pick me. You know, well, we're looking for the pick-me's, but they're going to come out of the 90% of the people we put in. So just trust. I was one of them. When Charlie Kalb came to see me in 2006 and he was toting that bottle of juice, I was interested in what the juice represented, and I gave it the due diligence of 1 year. I had no interest in building the business. So you have to remember how important this is, because of that product, because of my experience, is what gave me the vision to take this to the next level, because my belief in the product was there. Now, I had to wait a year because I needed the experience. With this scanner, there's going to be people that see the opportunity day one, and there will be people that see an opportunity within 60 days. Well, here's the deal. Whether they see the opportunity, whether they don't, at the very least, we want everybody getting healthier and healthier and losing weight. So that's our goal. Okay. Now, as you go to share the opportunity, as you go to develop your business, just know there's a couple places you can go. I'm not going to click on this now, but you can all write this down. I'll take a couple extra seconds. Monavie.com, the opportunity overview. When you go to Monavie, well, actually, I will do this. Let me see if it'll click. It does work. Good. You go to Monavie's website, and here's the deal. You can have the dream video right there, the more meaningful life video right there. Then if you go down here, you have the Monavie flip chart. So if you're a distributor and you're in Monavie, you have the ability to go to any of this stuff anytime you want. It's all online. You can send people there. That video's there, and the flip chart's there. Matter of fact, you can download that flip chart. Okay? That's Monavie.com, and that's in the opportunity overview section. If you want to see some videos that are really good, go to VeniceNutrition.com, and on VeniceNutrition.com, we have Mark McDonald, who helped us formulate the Reveal program with Monavie's Reveal product. Mark is an amazing guy. This guy understands nutrition. He understands the language of nutrition. He understands how hospitals and doctors and how they all think. He's been interviewed 2 or 3 times on a Dr. Oz show. He keeps on being invited back. Well, if you go to VeniceNutrition.com, you can see the host of media clips that, yeah, I can still do this. You can go to his website. That's the certificate thing there. And you can look at all the different videos that he's on Dr. Oz, CNN. He is a CNN correspondent or the nutritional correspondent to CNN. He's the ambassador to the American Diabetes Association. He's been on Dr. Oz. The guy is credible. He really, really knows what he's talking about. I'll tell you, when you're talking to a brand new person for the first time, these are some of the things I'd be talking about, because this guy standing behind the Monavie Reveal product knows exactly what's going on and can speak to that. So if you're talking to health professionals, if you're talking to personal trainers, he'd be a great person to make sure you start capturing those videos. Now, getting into the opportunity, real quick, we're not going to spend a ton of time on this. I know we're getting a little late on time. Here's the deal. What do you want out of this? When I looked at this sheet on this page in the flip chart, I thought to myself, you know what? With my health, I wasn't where I wanted to be when I first looked at Monavie. When I looked at my finances, I certainly wasn't where I wanted to be when I got into Monavie. When I looked at my time, my decision was, I'm working a lot harder for less, and I've been in business for 25 years, and I think a lot of people can say this. I'm working harder now than I did 20 years ago, and I'm doing it for less in my traditional business. Am I still in my traditional business? Absolutely, because I still want to meet people. But I'm going to tell you, this is going to change your life. So, if you can look at those 3 areas and say, is there anything out of life that you want that whatever you're doing has not given you, and you see the vision of this, then pay attention to it. This is our business model. It is really, really simple. We have 300 million people in North America that don't know anything about Monavie whatsoever. They don't know about the scanner. They don't know about the products. And so you go down and you look at the traditional way of making money. There's other ways you can do it. You can go out and buy yourself a franchise, and it talks about that there. I'm in a traditional business. I know the risks that are involved with it. I know the costs that are involved with it. But you know what? When you have a perfect storm of opportunity like this, with this product line, this scanner, the population that needs this product as much as it does, it is the perfect storm of opportunity for those who see the vision in it. Okay? This last page, next to the last page, I'm looking at starting properly. Real simple here. Remember I said the 90-10 rule? Well, the 90-10 rule applies here as well. You got to realize that 10% will be down here, 90% will be right here. And that's why you see senior executive kit, junior executive kit. These two areas are for that 10% that see a vision in this. If you have someone you're talking to for the first time and they look at this and they say, you know what, I can really see myself, doing something with this. Great, that's their choice. And it's our job to let them know what's going on. But you know what, you're going to have people are going to say, listen, can I just try the product for 2 or 3 months, 4 months? Let me do the 60-day guarantee, and let me see how I feel. And then if I really like it, maybe I'll delve into it then. Well, great. Well, then you're down here. Give these people a couple of cases of juice, get them on auto ship, and let them go. But you know what? If they see the vision, then you're going to have a conversation about the junior and senior executive kits. Down here, it's real simple. Whether they're in the business or whether they're not, they may not be active, but like that football player I was telling you about, he got himself a position back in May, did not want to build the business, but I can't even begin to tell you the amount of people he has referred to us to get on that program, the RVL program. Why? Because of him being that walking billboard. Everybody's noticed how he's changed in the last 6 months. So sometimes this just happens so naturally, it's ridiculous. So you know what? Now he's at a point, he's probably going to make the change to start looking at this a little more significantly, but for the last 6 months, it was a little different story, okay? It just continues on. I showed you how to put a person on the left, person on the right in that previous model. This is you. Put a person here, put a person there. That fulfills both left and right side. Start building your teams of people. You'll, at the very least, you're going to start seeing free product. Your income will depend on where you want to stop or if you want to stop. It doesn't have to stop there. Everybody's in for their own vision. So if everybody goes in and puts a couple people in and we teach that model and we keep sharing the story of Monavie, I'm telling you, this is going to be an incredible undertaking with this company. Okay? You can stop wherever you want. This just shows you the analyzed incomes from the beginning levels. I mean, let's face it, the beginning levels, you're not paying for product ever again. And it doesn't take a lot to get here. But you know what? You can take it to whatever level you want. It's up to you. The real deal is, if you stop sharing, that's where you kind of stop. All right? And it doesn't matter. There are people that said, hey, at Ruby level, $100,000 a year, I'm a happy camper. Take some time off. Great. There are some people that look at that and say, you know what? If I can make it to Ruby, I can make it to Emerald. If I can make it Emerald, I can make it to Diamond. If I can make it to Diamond, why not Blue Diamond? Well, remember the 90-10 rule? 90% will drink the product and utilize it for their own well-being and health. 10% will see the vision. Those are the people you're going to work with when it comes to the business model. You just have to remember that. This is just another page of the income disclosure statement. Monavie values people. This is a conversation for that 10%. Monavie has a skill and development system that's called the MVP. Monavie values people. It's worldwide. We're in all these countries and territories across the planet. We have to have a unified system to help us build our business. Very, very, very important, okay? You can't be in Israel and be doing what you're doing here in Naples, Florida. So they have a system that allows us to be able to have a worldwide company, but a worldwide system that'll keep it together. But again, it's that 90-10 rule. I don't have a conversation with MVP with someone that just wants to drink the juice for a couple months and see if their score goes up, okay? The More Project. This is where I believe, personally, Monavie is where it is today because we have been giving back to those kids in Brazil, and not just there. We've done the Haiti earthquake relief. We've done Japan. We've had things in Japan that during the tsunami, we took care of that. Thailand, we did the flood relief there. Down in South America, down in Mexico, we have the More Project for Mexico now. So we have one for India. So people have said, well, why just Brazil? Well, it started in Brazil. And then we started because this is where the berry gets harvested. We wanted to give back to the source, and we took an orphanage that had 50 kids in it and took up to 2,000 and funded over $17 million of distributor donations to that project, and Monavie took not one penny of administrative costs. We donate 100% of the administration that takes care of that More Project. So when I say we have a giving company, we have a giving company for sure. All right, back to the 90%, 10% rule again. Two choices here. I'm going to draw the line. 10% up here, 90% down here. Why do I say that? Just got to love them where they're at. Someone says to me, Rick, I see the vision in this. I want to get started. I want to do it right. I want to make a lot of money. I want to drink the products. What do we need to do? We're having a conversation about the junior executive pack. We're going to have a conversation about the senior executive pack because their mindset is of business building. If they're not of that mindset and they say, Rick, I don't want to build a business yet. I want to drink the product. I want to get healthy. Great. We love you where you're at. Welcome aboard. We're going to get them on juice. We're going to get them on Reveal. We're going to get them on a combination of them. We're going to get them down here, get them on auto ship, get them on the products that they need that will benefit their health. And that's it. Real simple. They can always transition and do this later. That is fine too. Okay, but you got to love them where they're at. I've always said in Monavie, love people where they're at, not where you want them to be. I can look at somebody and say, you could be the next Black Diamond. You know what? They may not see themselves there yet. Our goal is to get people healthy, and believe me when I say this, this product, this juice, will take care of itself. This is, like I said, the movie Shrek. You're going to want to make sure that the person that stands up and waves their hands and says, pick me, they're going to come out of the people that you enroll, okay? So you just love them where they're at. Here's how we do this, and we're going to start closing up. This is in the second to last page. Get your score. Our goal is to get everybody scanned. Our goal across North America in the next year or so to scan 100 million people. Remember, those 100 million people, 90% of them are going to fall in the range of obesity and fall in the range of poor nutrition. We already know the numbers. It is what it is. It's going to be a matter of what do they want to do about it, and we're going to offer them a solution that does work. And so we want to position ourselves for that. So you've got to start with a discovery. Remember, slide 1, discovery. Get their score. Remember the solution. Number 2, talk about the products. Give them an opportunity to select what product will best benefit them. That's what the solution talked about. Opportunity, then the opportunity's there. Now, some people will see this right from the beginning. Some people won't. Doesn't matter. But we show them the opportunity either way, okay? You get them to enroll whatever product they want, okay? Get them on their auto ship, and the reason the auto ship is so important, let's face it, in my case, I was 50 years old when I got involved with this, 51 years old. It took me 50 years to beat myself up to get my body where it was. I mean, it makes total common sense that it's probably going to take you more than a bottle or a week or a month to start the corrective measures. And so I gave myself a year on the product. I said, let's see how it goes in a year, and if I like it after a year, I'll stay on it. If I don't, I'll quit. But it changed my life. But I did the proper due diligence. So the initial order is important. The auto ship is very, very important. And then show them the flip chart. This flip chart is only 14 pages long. I went a little bit longer tonight because I want to do a little bit of teaching about the format of the conversations that should follow throughout the flip chart. But all in all, the flip chart is 14 pages long, and you should be able to get through it in literally 15, 20 minutes. When I'm all done, I'm giving people an opportunity. Here's the deal. You get a 60-day money-back guarantee on any of the Monavie products, whether it be Reveal or whether it be the juices, on improving your score over the next 60 days. And so, I mean, that is what it is. And it's just totally a win-win situation. There's really no downside. There's no risk factor whatsoever. If you go to MonaviVO.com, if you are a distributor, I'm giving you this because this is important. You start watching where these meetings are going on. Monavie VO is being utilized as the main calendar of events for everything that's going on in the United States. They're starting to post, and you're starting to see I'm having my meeting here in Naples next week. It's right here. Look to see, do you know people in Urbanvale, Iowa? Do you know people in Naples, Florida? Do you know people in Norwich, Connecticut? Irvine, California. Look at the places and say, you know what? I have a friend that lives in Irvine. Send them. I have a friend that lives in Norwich, Connecticut, wherever that is. Send them. Ossau or Wisconsin, West Palm Beach, Florida. There's a lot of stuff going on. East Hartford, Connecticut. Important. Keep an eye on this. Worldwide. Look at what's going on in Asia. I mean, we're in 23 countries and territories right now. This is going crazy. If you go to the Monavie VO website, go to their events calendar, you can see where these meetings are worldwide. Okay. In closing, I want to thank you all for being on the call. I said I would wrap this up as quickly as I could. I went a little bit longer tonight than I anticipated, so I'm going to end with this. We love you being on the call. I really appreciate it. Pay attention to what's going on with Monavie. We are in a time that we've never been in before. We are in the perfect storm of opportunity. Everything has come together. at a fine point in time between the scanner, the juices, the science, the new developments, the business model. It has come together in a way that has never happened before. And with the medical facilities across the country that have started to embrace Monavie, and Monavie will probably come out with a program for these hospitals and for these doctors' offices and these clinics. They're going to come out with something that's going to be utilized for them. Just let me say this. It's going to be a major undertaking, but when it's all said and done, I think we'll have one of the only products in the world that'll be utilized in both the atmosphere of the community commerce and also in the medical environment. So I'm here to tell you, to me, we have Microsoft in a bottle here. So pay attention to what's going on. I hope this was a great webinar for you. Hope you got something out of it. I did record it, and hopefully we'll have it up on the site sometime next week. I appreciate it. Thank you all for being here. Good night.